Christmas is just around the corner, a much anticipated time of the year to bring comfort and joy and to be merry and bright. Admittedly, it's a lot different this year because of the COVID-19 pandemic. But don't despair. More than these challenges we face, there are so many reasons to celebrate and to keep the holiday spirit alive. On the program today, how can we spend time with our loved ones during this joyful season while keeping everyone safe? Welcome to MedTalk Health Talk. I'm Dr. Freddy Gomez. Meeting with family members this time of year is something we all look forward to, but we're still in a pandemic, so we have to be mindful. I like the word mindful rather than careful. It's time to meet our guests for today. We have on the show Dr. Jonathan Lim. He's a pediatric infectious disease specialist from Chonghua Hospital. We also have Dr. Celi Magpantay, who is a clinical psychologist from St. Luke's Medical Center and the De La Salle University. I'd like to start first with Dr. Lim. The health department said that cases could surge over the holidays. Now, with this in mind, why is this the case? What are we anticipating this holiday season, Dr. Lim?
With the long holidays coming up, we expect people to go home, people to go into reunions. So we do expect really to see a big surge probably by January. So hopefully this won't happen. So we're keeping our fingers crossed.
And Dr. Lim, just to follow up to the question, we're expecting this big surge because of the practices that people may be doing. They might be still doing the same things that they would do last year or before the pandemic. Is this correct?
Yes, that's true. We know with our culture, for example, we always go into reunions, get-togethers, Christmas parties. That's something that's given in Filipino culture. In fact, as they say, we have the longest Christmas in the world. So that's one thing that we're really scared of.
Yes, and this COVID-19 pandemic has given us a chance to make adjustments to our day-to-day lives. Celebrating Christmas and social distancing are actually a nice combo. But is this actually possible, Dr. Lim?
Yes, it is very possible, especially getting together with your family and friends. As long as you practice the social distancing, wearing your mask, and hand washing. Those are the 3 W's, that we have to keep in mind. And as you said, be mindful.
Now, experts have been saying that 6 feet or almost 2 meters ang dapat na distansya from one person to the next. So let's talk about social distancing this time. So konting review lang tayo. Awkward as it may seem, that distance we maintain can make a difference even during a family get-together. But it's better safe than sorry, hindi ba, Dr. Lim? Because matagal na natin itong pinag-uusapan. But what are the scientific benefits? Because we don't want anyone letting their guard down ngayong holiday season.
Yeah, that's true, Dr. Freddy. At least 2 meters would be a safe distance. But take note, that's when you just have usual na conversation. Iba yung you have cough or you sneeze and it's 2 meters, baka kulang pa yan, Because as we know very well, it's droplet. But then, pwede siyang magstay in the air, yung virus, for the next few meters, especially if it's through cough or sneezing. But normally, 2 meters would be a safe figure for everyone.
Now, I just want to remind our viewers, people who are immunocompromised or have underlying medical conditions are at higher risk. So mabuting maisip natin yan when we visit or are looking to visit those we love. Also, another important thing is wearing your mask. Dr. Celi, how can we balance stress of being with our loved ones at the same time protecting them from possible infection?
So right now is to balance the stress is to know some other alternative when you can get connected. Because we are a social being, and being means you are interacting with the people that matters to you. So it cannot be always physical. Right now, we can enjoy virtual activities that we can connect, keeping in mind that this is just temporary. This is the new normal. And the most important is everyone will be safe.
And of course, there can't be a party without good food, because we Filipinos love our food. Now, during this holiday season, we look forward to our special treats. But here's the thing. There's no evidence yet that handling or eating food is associated with a direct spread of COVID-19. That's why I'd like to go to Dr. Lim. Can we explain this to our viewers so that people don't worry unnecessarily? Because marami pa rin ang nagpapanik tungkol dito.
Yes. So far, wala pa tayong recorded case no, that it's a foodborne infection. When you say foodborne infection, that means kumain ka ng something, no? You ate something na contaminated with a virus or bacteria like amoeba, hepatitis A, typhoid. But so far, wala pa tayong recorded case with COVID-19. No? So wala pang infection na ganon.
Now, the idea is to be mindful or cautious with touching surfaces. Pero syempre, hygiene is critical. Dr. Lim, what are your top food safety tips and food preparation tips? Dapat ba ay nakasuot pa rin ng mask while preparing food?
Well, of course, if you have symptoms, syempre hindi ka na mag-prepare ng food. No? You should quarantine yourself kung may symptoms ka na. But without symptoms naman, if you're cooking, okay lang naman na hindi. No? Kasi you're preparing naman. Although if you want to wear a mask, go ahead. No, there's no problem with that. But what's important is to separate your raw food from your cooked food. No? For example, you have your vegetables or fruits, dapat nakahiwalay yan sa mga meat products. Hindi yung isang tray lang silang lahat. And what's important is if you buy food from outside, the ideal way is to separate yung container from the ones that you bought and then put it in your own container and transfer them and put them on the dining table.
Dr. Sally, what's a good advice for our viewers whenever they encounter confrontation with someone who does not like to wear their mask properly or ayaw mag-follow ng mga safety precautions? Ang mga Filipinos in general ayaw ng confrontation, di ba? Pero what is a good way? How can our viewers approach this kind of situation?
In a more subtle way, if we cannot say directly na you should put your mask on, better to have an extra mask and then give it to the person. It's like a polite way of saying you put this on and this is a very safe protocols that we need to continue. Second is if the person still reject your offer, just make yourself safer. You distance yourself.
Siyempre, hand washing, sanitizing surfaces, and appliances are important. But sa pagluluto, don't mix raw food products and those that are cooked. No risk of COVID-19 there, but there are other illnesses that you can catch. And here's one more reminder. If you're not feeling well, we suggest that you stay out of the kitchen and get some rest instead. It's your safety and that of others that we need to always remember. Now it's time to eat. That's part of the Filipino tradition during the holiday season. Food is at the center of it all. More after a short break. You're watching Med Talk Health Talk, where your health comes first. Tis the season to be jolly and the season to stay safe. Welcome back to Med Talk Health Talk. I'm Dr. Freddy Gomez. We're all looking forward to spending time with our loved ones this holiday season, but we're still in the middle of a pandemic and we know COVID-19 can spread from person to person. I'd like to continue the discussion with Dr. Lim. Dr. Lim, what are some of the general rules that we can follow in order to avoid getting sick or getting someone sick for that matter?
In the context of COVID-19, of course, we have the 3 W's we mentioned earlier, mask, social distancing, as well as hand washing. But what's important is if you have symptoms or you think you came across someone, lumapit sa isang tao na may symptoms, then you're in doubt if you have the virus with you, probably it's better to stay at home. But then if you would not be able to say no to an invitation or you need to go out with your friends or family, then observe the usual standards and just be wary about your environment.
So the larger the crowds, the greater the chance as well that someone might have COVID-19. After all, bawal pa rin naman ang mass gatherings under GCQ. Although some experts do suggest that we celebrate Christmas with the people we live with at home. So, what are your thoughts here, Dr. Lim, na ang tamang celebration ay yung mga dapat nakatira lang sa sariling bahay or under one roof?
Yes, actually, Dr. Freddy, that would be the safest way right now, no? If you really have to celebrate, stay in the house, no? Cook your own food, tapos yung lola who are living in another house, or relatives and friends, they stay in another house, and then virtually na lang, no? You eat together, but magkalayo.
And also, when we look at restaurants nowadays, outdoor seating is actually preferred or well-ventilated places. Dr. Lim, should that be the case when we get together with family members? What are the advantages of holding celebrations outdoors?
Yes, Doc Freddy, that's actually a better option if you really have to meet up outside, no? Kasi with an open space, you have better air exchange, no? May hangin, rather than an air-conditioned room, no? Early into the pandemic, in China yata yun eh, they have studies to show na people who eat in restaurants kasi naka-aircon nga, sarado siya. So if there's someone on one table na may COVID, kahit 2 or 3 tables away, pwede pa rin mahawa kasi it's an enclosed space. Of course, hindi ka naman kumakain ng 5 minutes lang or 2 minutes lang, di ba? You stay there for several hours, talk with your friends. So it's better if you stay out in shall we say, an outside environment if you need to go to the restaurant.
We have been talking about all the safety steps we need to take when we celebrate Christmas. Continuing with Dr. Lim, so if you're hosting a get-together, how can we make our guests feel safe in our own homes? What kind of guidelines or tips should the host of the house follow?
So what's important is to be really careful with the people around you, and when you really need to talk in a lower voice, hindi yung wild, and maybe less alcohol kasi when alcohol level is high in the body, you may have no control anymore.
Now, one of the tips as well is, they say, is that it's best also that we have one person serving rather than multiple people getting their own food. I'd like to have Dr. Selly give her opinion about this.
I think it's very important to emphasize in any celebration some ground rules to prepare us mentally what to expect on a celebration. We know that the safety measures are already in place, and if we wanted to celebrate, it has to be followed religiously. So one suggestion is set the ground rules ahead of time, and at least there is a way in which the people who were invited know what to expect, and because the expectation are laid off ahead, they know how to handle, how to interact in a more safe way. So there's a what we call share responsibility in this Christmas celebration or season. We would expect that adult will follow. Of course, there's a different measures to take with children, but it's very important that there's a bigger priorities more than the get together. Second, the meters that Dr. Lim mentioned already, even though you are distance apart, once we have brought into a space like at a home, we feel safe at this point in time. No? There's also a psychological atmosphere built in the presence of the other. It's better than just do it virtually. So again, the most important is setting the expectations and putting everyone responsible on the celebration.
Shared responsibility, I like that very much. As long as you inform your guests beforehand what to expect, then things should be okay. Now, going to Dr. Lim, many people are probably wondering how safe is it to go and celebrate the holidays in other people's homes? Are there any rules on the amount of time spent in parties with other people? Should they follow a certain time limit for this?
Nako, mahirap yan. Kasi if you're going to say rules, well, it's less than 15 minutes actually. So you cannot go visit someone, hanggang 15 minutes lang ako. Kasi di ba, especially in an enclosed space, literature or experts would tell us, pag lumagpas ng 15 minutes with a certain person na may COVID infection, then you have higher risk of getting the infection. But then the problem is, you cannot go visit someone for 15 minutes lang na magre-reunion kayo. No? So that's medyo a bit out of the question. So the thing is, make sure you have no symptoms and make sure rin na walang symptoms yung host. No? And always, probably, as Doc Selly has mentioned kanina, we just have to be frank and talk to these people and ask them if talagang may symptoms sila o wala, no? If you really have to go. Although, again, the safest would still be stay at home and use your virtual platform to meet up with these people. Konting tiis lang, no? This too shall pass.
And we want this to be a very Merry Christmas for all. So it's really about understanding our challenges and not resisting all that we can do to keep each other safe. Are you on the same page as your family members on how to celebrate Christmas? We'll talk about that next after a short break. Stay with us on Med Talk Health Talk on CNN Philippines. we can definitely have a happy and healthy holidays. And like most everything this 2020, our Christmas will just be a little different because of COVID-19. But different doesn't have to be a bad thing. Welcome back to MedTalk Health Talk. We can't lose sight of the many healthy practices we have been following over these past many months. And this isn't the time to forget about them as well, even when we are at somebody else's home. And there are a lot of food options at get-togethers. Dr. Selly, how important is it to make healthy choices, especially when it comes to gatherings? Or okay lang ba yung mga healthy the whole year, but then may konting cheat day sila during this holiday season?
I think the cheat day comes with the idea of rewarding yourself, right? And in the Christmas holiday, we know we are very extravagant with our celebration, especially with foods. So right now, since with the pandemic, it's not bad to have a cheat day, but plan it well. If it's on Christmas, you can cheat with something that is healthier. Now, the choices naman depends also with your diet. At the same time, you have to do mind setting. Because if you're expected to see lechon and the more traditional delicacies that we enjoy on Christmas, and you know that somehow it will affect your diet in the long term, you will feel guilty after the cheat day. So again, always in moderation. It's very important, no? When you're taking that as a measure. Plus, choosing the right food, I think it's really part of the new lifestyle and new normal right now because we wanted to be healthy first and foremost because of the challenges of the pandemic. We wanted also to keep the family tradition closer by eating together, not just merely the food that we are serving regularly on the table.
I agree. And Dr. Lim, between now and the new year, what are your best tips for our viewers when it comes to diet para maganda ang kanilang immune system?
Yeah, what's important, as Doc Sally mentioned naman, no, is to have everything in moderation. No? Eat a balanced diet, proper sleep. You have vitamins, maintain your vitamins. No? So that's basically what's important. What's important right now, no? With this pandemic and even without the pandemic, balanced diet, proper sleep, and usual multivitamins if you need to take them.
Everything in moderation is my favorite advice. Now, in these times, it's so easy to focus and dwell on the negative aspects instead of the positive. A lot of people say that they are eager for 2020 to end because of all the negative things that have happened in the world, and I can't blame them. Now, Dr. Selly, how can people focus more on the positive this holiday season and end the year with a better outlook on life in general?
I know it's not easy. It's always a challenge to keep your mind in a more positive direction. One thing that I can suggest is do journal writing. It's very good practice in positive psychology. You list down some of the things that you're grateful for. It can be as simple, able to eat chocolate or splurge in Netflix. So make it a habit na small things to be grateful for because once your mind is trained to look at things that are positive and you're taking down notes of that every day, it expand and of course it will also impact your positivity. And then when you commit yourself to be positive all the time, taking into gratitude, I think it will change your paradigm to see the brighter side. We develop that sense of hope.
We want to thank our guest for today, infectious disease specialist Dr. Jonathan Lim and psychologist Dr. Selly Magpantay. We appreciate your time very much. And amid the challenges we face, no matter what the circumstances are, Christmas brings us so much joy. But it's a gift of health we must all enjoy. Thank you for watching. I'm Dr. Freddy Gomez.